Hi, it's Dr. Jenny here, and this week I want to talk a little bit about the supplement called N Acetylcysteine, or NAC for short. It's getting a lot of publicity these days, and one of the things that I'm noticing is it's getting a lot of talk because there's some question of whether the FDA has banned it or is going to ban it or whatnot. So let's talk a little bit first about that situation, and then I'll get into the pros and cons of it and all that kind of stuff. But um, in 1963, this was classified in a way that the FDA made the FDA kind of go, well, maybe we should call this a drug, maybe we should call it a supplement. So fast forward a bit of time, and with everything going on in the world, they've kind of said, ooh, we want to make this a drug. So instead of making it widely available for people everywhere, which has been done for decades and decades, it's safe, effective, and it works in a lot of cases. They want to take control of it, and so that's why I know that Amazon is not allowing it to be sold in its platform, and so it's a little bit hard to get your hands on. So if you get to the end of this and you are like, hey, I need to get this and I can't find it, reach out to me, send me a message, and I will help connect you with a good source, because I have a way to get it. And one of the things that I do is create custom packs of supplements with things people need in them, and that's something that I include in a lot of cases. So let's dive right into what is N-acetylcysteine, and why would you want to take it. So it does a number of things. The most important thing that you need to remember about that is that it helps your glutathione levels. And glutathione is considered by many people, it's described as the master antioxidant. So all the time we are exposed to things that we need to clear out of our body, and it is glutathione that helps us detoxify a lot of these things. So in the absence of proper levels of N-acetylcysteine, we don't build glutathione properly and convert it. You cannot take supplemental glutathione, so you have to take the building blocks. And N-acetylcysteine is one of the building blocks that will help you convert to glutathione. So that's one of the big reasons you want to do it. It helps with the free radical damage that glutathione helps address in your body. It helps support the detoxification process, specifically in the kidneys and the liver. So it's super potent. It's used when people overdose on acetaminophen, and yes, you can overdose on acetaminophen. They will pump you, they'll give you an N-acetylcysteine IV at the hospital sometimes to help you flush that out. So it does work. It's very powerful. Number 3 thing that it does is helps you regulate glutamate. Glutamate is one of the very powerful neurotransmitters or brain chemicals that we produce, and if we have an imbalance in that neurotransmitter, then we have mental health issues and things like that. So that's obviously like a huge topic, mental health, but addictive behaviors and things like that. So the regulation of that neurotransmitter is helped by adequate levels of N-acetylcysteine, and we want that to be optimal because we want to support good brain health. The respiratory effects, that is what I think we're seeing the uptake in right now. People that have gotten, and I won't say the word because I don't want to get flagged, I won't say what it is that they've been exposed to, but the long-term effects, they're having trouble breathing and things like that of this virus. But proper levels of N-acetylcysteine help to support respiratory function so that we can decrease the inflammation in our lungs. Historically, it's been used with chronic bronchitis and asthma and things where people have trouble breathing and coughing all the time. And it helps to thin the mucus. It works like an expectorant, loosen up the mucus and reduce the inflammation in your lungs so that you can breathe easier. Fertility. This is such an interesting, most people don't know about this, but especially relating to males, sometimes their sperm count can be lower because there's oxidative damage, and those tissues are very sensitive to the destruction that happens in that oxidative damage. So there's studies that you can look at, and in terms of improved sperm motility and sperm count in men who go through a period of time of taking N-acetylcysteine as part of a treatment protocol to increase their fertility if there's some issues there. And I've actually used this in my practice with people successfully to help them, address that and build that. So that's on the male side. On the female side, there's some studies that show that this helps in the world where women have PCOS, which is polycystic ovarian syndrome, and their fertility decreases because they have anovulatory cycles where they don't ovulate. Well, N-acetylcysteine, there's some research around that supporting that and helping get back in the rhythm of ovulating properly. So obviously, big deal there. And then blood sugar, stabilizing blood sugar. And the mechanism that happens here is that you reduce the inflammation in the fat cells, and then you improve your sensitivity to insulin. And we know that faulty blood sugar handling has implications across the board. People that have diabetes or are pre-diabetic, they are getting sick more than other people. Cancer is a metabolic disease where we have blood sugar handling issues. So blood sugar handling is really big, and N-acetylcysteine may very well be part of that equation in addressing that. And then the other thing it does is decrease oxidative damage to the heart. If you're catching the theme here, it's reducing oxidative damage and creating reduced levels of inflammation in the body. That's the big picture of why you want to make sure that you have enough of this nutrient on board. And then boost your immune function too. That's what we're seeing. That's why so many people are trying to get their hands on this supplement. And it breaks my heart that the FDA is trying to keep it from people. So if you are thinking, hey, I might be interested in taking this supplement, if it's available to you and you can invest in nutrient testing, I always say this to people, like, that is the best way to know exactly what you're low on and what you need to be taking. I test nutrient levels on people all the time. A lot of them show up needing glutathione, some don't. Because you can get, N-acetylcysteine is the substance we're talking about. And if you eat a diet that's high in meats and poultry and things like that, you're getting a lot of the amino acid cysteine, and you are converting this. So some people are doing a really good job in their diet and they're getting everything they need, but a lot of us aren't. So, do you just go out and get some and take it, or do you want to take a nutrient test and find out exactly what you need? If that's available to you, that's always the best way to do any nutrient. But if you're just going to run out and get it, the dosing on that is about 600 to 1800 milligrams per day is the range. I usually use about a gram, which is about 1,000 milligrams a day with people when I recommend it. So just somewhere in that is a safe range. So anyway, I hope you found that helpful. I just feel like that nutrient, there's been a lot of talk around that, and I wanted to take just a few minutes and provide some really good value in the background on it, why you might want to take it, and things like that. So hope you found this helpful. Thanks for watching.